What's up, Unleashed Humans? If you know me, you know that I am constantly trying to make my life, my health, and happiness the best it can be. Whether that's getting stronger, optimizing my digestion, trying new biohacks, and simply finding ways to become happier every day. If you're looking to do the same with your life, then I have just a thing for you. And the best thing is, it's all in one place. And that special something is a free copy of my book, The Unleashed Human. Inside this book, you will find the strategies I have learned and tried to optimize my life and body. You can get your free copy of The Unleashed Human by going to www.theunleashedhuman.com/unleashed. Again, that is www.theunleashedhuman.com/unleashed to get a copy of my free book. No shipping, no payments, totally free, straight to your email. Check it out while it is still up for grabs. Now, on this episode, we talk about why taking care of your spine is extremely vital for you to be healthy and thriving. You know, that thing in the back of your body that keeps you upright and allows you to move your legs, yeah, that thing is your spine. That thing also controls every single organ, tissue, muscle, and function in your body. Yeah, it's called your spine, like I said. You should probably pay attention to it more often because it is what determines your quality of life. When your spine becomes decrepit and degenerated, it starts to lock itself into place, which means your spine is literally fusing itself to itself. Your bones start to become fixated and your range of motion becomes severely restricted, leading to nerve impingement. Now, your nerves then become compromised and all your organs, tissues, and cells suffer due to loss of nerve flow to keep them alive and healthy. Now, this episode, I will warn you, is likely to become quite controversial as I talk about different types of spine management approaches and why some of them fail. I will also be talking about types of chiropractic care and why they are so different. So if you've had a bad experience with a chiropractor, I will tell you why that was probably the case. Or if you went to a chiropractor and you were immediately turned off because of how weird and quacky they were, I will also tell you why. Trust me, I know how weird chiropractors can be because a lot of them do really esoteric things that are beyond what seems scientifically reasonable. There are, however, chiropractors who provide scientific evidence and research for what they do. Now, these chiropractors are super analytical and make sure that their patients understand how the human spine works and how the human spine functions based on biomechanics and loading forces on the spine. You see, visiting a chiropractor is just like visiting a dentist or visiting a medical doctor. If you went to visit a dentist and they did a piss poor job leaving you with a bad taste in your mouth, literally, would you just decide, I'm never going to get my teeth cleaned again, and I'm never seeing a dentist as long as I live? Or would you just find a better dentist? I'm pretty sure you would find a new dentist because we all know regular checkups are crucial, as we know that gum disease can lead to many issues like cardiovascular disease, neurodegenerative disease, and even diabetes. Just like you wouldn't immediately opt in for a spine surgery, you would seek all conservative approaches to spinal care before spending hundreds of thousands of dollars with the potential of becoming paralyzed or even becoming worse from undergoing surgery. You also wouldn't ever discard all medical doctors forever because we need medical doctors for things like emergency medicine or severe bacterial or viral infections. Every single healthcare provider and practitioner plays their role in healthcare today, or else they wouldn't have board advisories set up for them to exist. That being said, you need to find the right practitioner for you and don't lump all of these practitioners into a group as the same. Do your homework and you will likely find the best fit for you. Now, here's the thing. Dentists, just like chiropractors, all practice differently and have different techniques. Although both dentists and chiropractors go through a 4-year program, undergoing the core curriculum in order to pass national board testing, they also undergo specialized training in the technique or specialty of their choosing. Some people are either turned on or turned off by the specialty of these physicians, but in my experience, most humans prefer visible, tangible, factual, and scientifically based healthcare and treatment routes. Care that someone can actually understand and visually make sense of. That is why I practice the most scientific and research-based form of chiropractic on the planet, which is called chiropractic biophysics. Now, unfortunately, I'm embarrassed to say that a lot of my chiropractic colleagues do things that are way out of what is reasonably acceptable for healthcare standards. Things like doing energy-based chiropractic, where the chiropractor isn't even touch you, and they say that they were able to adjust your spine with their mind. Or chiropractors that do muscle testing techniques to see which nutrients your body is or isn't deficient in. Some people are into this thing. I get it, and sometimes it works for certain people. But if you're a more analytical person who needs the facts to understand really what's going on with you, then you're going to be extremely weirded out, and then you're going to lump the entire chiropractic profession into an insane group of quacks out to take your money. Believe me, I get it, because I would feel the exact same way if I was looking at chiropractic from the outside in, okay? However, just know that is just a small population of the chiropractic profession, and that many chiropractors are extremely knowledgeable and research-based physicians. That is to say, myself and my other colleagues who practice chiropractic biophysics technique work with some of the world's top orthopedic surgeons, neurosurgeons, neurologists, and medical doctors. That is because they understand how biomechanics, orthokinematics, and postural deformities put stress and strain on the spine through repetitive micro and macro traumas over our lifetime. And when we show these physicians how we are remolding healthier postures and spines by implementing chiropractic adjustments, strengthening weakened muscles with dynamic exercise, reestablishing proprioception and balance to the brainstem using vibration platforms, and stretching spinal ligaments, which is the glue of our spine, into positions that keep our spine upright using spinal traction units. Now, by using all of these tools, modalities, and treatments, this allows other healthcare providers to truly understand what we do makes logical sense. Because at the end of the day, we are trying to bridge the gap between medical models of surgery and drugs towards implementing more conservative approaches to healthcare first through chiropractic, nutrition, and physical therapy. Now let's touch a little bit on this thing called chiropractic biophysics that I mentioned earlier. Now, my job on this episode is not to persuade you or to show you that I have a bias towards chiropractic biophysics, because I don't. Really, my purpose is to simply tell you about the technique and how it provides incredible outcomes. In fact, I don't have to persuade you into anything, because the research itself sells chiropractic biophysics alone. I don't intend on putting any other chiropractic technique down, but I do intend to show you how chiropractic biophysics is a technique that is tangible and understandable, that everyone on planet Earth can easily understand because it is backed by solid research. Now, let's talk about the technique. Just like there are normal measurements for blood pressure and cholesterol levels, there are also normal measurements for the human spine. These normal measurements of our spine are known as the ideal spine model. This model was founded by Dr. Don Harrison, who received a master's degree in mechanical engineering and a PhD in applied mathematics, which, if that wasn't impressive enough, he attained these degrees simultaneously and had to have special approval from his university's educational board to work on these degrees simultaneously, because no one in their right mind would do these together due to how extremely rigorous they are by themselves alone. This is to say, Dr. Don Harrison was an extremely intelligent and hardworking individual. Dr. Don was almost savant-like, with a passion to advance the chiropractic profession to what healthcare should be focusing on, which is to looking at the spine first to determine how curvatures and postures affects a person's health. In other words, the further away you get from a healthy and normal spinal curve, the lower the quality of life you will endure. The other side of the coin is the closer you are to the ideal spine model that humans have, the healthier and higher quality of life you will endure. Now, quickly before we move on, I will tell you what the normal curvatures of each part of our spine should be according to the ideal spine model in humans. Now, if you didn't know, we have 3 major regions of our spine. First is our cervical spine, which makes up our neck and has 7 bones from C1 vertebrae all the way down to C7 vertebrae. Now, our neck has a lordotic curve made from a piece of a circle. The ideal degree of curvature of our cervical spine is 42 degrees, and a normal degree of curvature is 34 degrees. This being said, you want a lordotic cervical curve anywhere from 34 and 42 degrees. Second is our thoracic spine, which makes up our upper and middle back and has 12 bones, T1 through T12. Our thoracic spine has a kyphotic curve that should have an ideal curve of 44 degrees from T1 to T12 so that our heart and lungs can function at their best. Third is our lumbar spine, which makes up our low back and has 5 bones, L1 to L5. Our lumbar spine is lordotic in nature, just like our cervical spine. However, it is a piece of an ellipse instead of a circle. The ideal degree of curvature for our lumbar spine is 40 degrees. Now, the more your spinal curvatures start to go below or above these values, the more pain, organ dysfunction that you are likely to incur. Now, that's not always the case, but we do know through research, we see people enduring pain the further away you get from normal. Now, like I said, after this episode, I will likely have other chiropractors being mad at me or coming out of the woodwork stating their case. Great, I invite that, but the reality is this: you can't argue facts and science that has been given solid evidence that has been published in some of the top spine journals on planet Earth. Now, that being said, the standard chiropractic adjustment, which chiropractors are known for, is not what creates lasting change from pain, organ dysfunction, and even posture deformities. The chiropractic adjustment is an amazing treatment for acute care and symptomatology. Things like headaches, neck pain, back pain, joint pains, jaw pain, constipation, numbness and tingling in the extremities, and the list goes on. However, as much as I hate to say it, a chiropractic adjustment is a temporary band-aid, because if you've been to a chiropractor before, you get adjusted and you feel great for a week or so, and then what do you have to do? You have to go back for another adjustment. This is because an adjustment really only releases nerve pressure and increases physiological range of motion for short periods of time until your spine, muscles, and ligaments go right back to where they were. You want to know why? Because the adjustment did nothing to change your posture long term. Listen again. The adjustment did nothing to change your posture long term. If you get nothing out of this episode other than understanding that permanent posture change is the ultimate determinant of eliminating spine pain and increasing nerve function, then I will have done my job. That being said, a chiropractic adjustment can only change posture temporarily. The only way for posture to remain permanent is by retraining your muscles and ligaments to hold your spine in place in the proper form. Okay? Now, this will lead to much better outcomes like nerve function, athletic performance, brain performance, organ function, and dramatically increase your quality of life. You also won't need to get adjusted every damn week. So put the idea that you have to see a chiropractor for the rest of your life to bed. Now, as I stated earlier, I myself am a doctor of chiropractic, and I treat the spine in a conservative, non-invasive, and drug-free fashion. Now, at the time of this recording, I work alongside Dr. Miles Fortner, who has been published in 5 peer-reviewed PubMed Index journal articles on conservative treatments of spinal deformities using chiropractic biophysics protocol. 2 more research cases are actually expected to be published here in the coming months with my name on it as the lead investigator. Now, if you don't know what PubMed is, it is one of the largest research databases in the world for new advances in science, health, and human advancements. This being said, the type of chiropractic care that we do inside our office is literally unlike any conservative treatment you will ever find. Just about everyone has a spine-related issue in their lifetime, whether that is physical pain in the neck, upper, mid, and lower back. Now, spine-related issues, however, are not always perceived as spine-generated. In other words, most people don't even realize that their current condition or issue is coming from their spine. For instance, having chronic migraines or headaches have been known to be spine-generated, but most people think that they have a brain tumor or a neurological deficit. We're always thinking that it's worse than it actually is. Well, what we find as chiropractors more often than not is that those people with chronic headaches are suffering from an unhealthy cervical spine, also known as the bones in your neck. Now, headaches are just the tip of the iceberg when it comes to poor functioning spines and spinal cords. The conditions and symptoms you have been suffering from your entire life could be coming from a poor posture, which leads to poor spinal structure, which puts a ton of pressure on your nerves and decreases nerve conduction velocity and impulse to every single cell, tissue, and organ of your body. Let's first start with some conditions relating to an unhealthy cervical spine, aka an unhealthy neck. Again, these are things that you have been living with that you may have never thought could be due to an unhealthy neck. So things like migraine headaches, tension headaches, ringing in the ears, vertigo, dizziness, nausea, jaw pain, jaw clicking, grinding teeth at night, snoring, sleep apnea, spots or floating lights, numbness and tingling in the hands, coldness in the hands, weakness on grip, dropping things easily, forearm cramping, getting sick easier than most people that you know. And when you do get sick, you stay sick longer than most people. You could even be suffering from thyroid dysfunction, troubles regulating body temperature, and that kind of thing. Now, that's a lot of stuff, right? And those were just the conditions related to a poor cervical spine, aka the bones in your neck. But again, you could have been living with this for your entire life and not even understanding or knowing that it could be coming from your neck that is causing the dysfunction in the rest of your body. Now, I'm going to give you a quick case report on a woman with a cervical spine condition that drastically decreased her quality of life. This woman had a large right head translation along with a surgical cervical spine fusion. If you don't know what a right head translation is, imagine a string is attached to your right ear and is pulling your ear purely to the right, which is parallel to the ground. Now, 2 CBP or chiropractic biophysics colleagues, Dr. Paul Oakley and Dr. Deed Harrison, published a case report on this woman in particular. I will mention first, before we dive into this case, that Dr. Deed Harrison is the son of Dr. Don Harrison, who we spoke about earlier. Dr. Deed Harrison is currently the president of CBP Technique and Seminars. Now, this case I'm going to tell you about can be found in the Journal of Physical Therapy Science and is titled Alleviation of Pain and Disability in a Post-Surgical C4 to C7 Total Fusion Patient After Reducing a Lateral Head Translation Posture, a CBP case report with a 14-year follow-up. Now, that was a mouthful, so I will have these research articles at the bottom of the show notes so that you can link to it and read it for yourself. Now, let's dive into the case. Now, let's set the stage first. This was a 56-year-old female who had turned her neck a certain way, and instantaneously, she felt a pop in her neck and immediately had localized neck pain. If you don't know localized neck pain, it just means that you started having neck pain in the immediate region of the pop or turn or anything of that nature. Now, this woman went to see a local chiropractor for pain relief, but unfortunately, this chiropractor failed to do a proper examination and x-rays. What the chiropractor failed to understand is that the patient already had a pre-existing condition in her neck known as a congenital fusion of two segments of her cervical spine. Congenital, for those who don't know what it means, congenital means that she was born with it, as opposed to a surgical fusion when bones are fused together with surgical materials. Now, the only way for a chiropractor, or that chiropractor in particular, to know that she had a congenital fusion is to take spinal x-rays, in which this chiropractor in particular failed to perform. She also had an injury of the joint above the fusion where a bone had shifted forward, which is known as an anterior listhesis, which is commonly found above or below those patients with congenital fusions, meaning that the bones are slip sliding too much on top or below the area of concern. So this chiropractor was completely blinded of her condition, and this chiropractor adjusted her neck. And immediately after the adjustment, it made her neck flare up even more and sent pain down her right arm. Now, I'm not here to put down other chiropractors because, like I said, I'm a chiropractor myself. What I am putting down is any healthcare provider that fails to provide a standard of care, whether that is a chiropractor, dentist, medical doctor, or even a naturopathic doctor. In this case, the chiropractor did not take x-rays to see if she may have an underlying pathology, whether that was an unstable cervical spine, spinal degeneration, cervical fusion, or even a more sinister but rare malignancy. Now, after the patient was adjusted, she got concerned, as anybody would, because she was in pain, more pain now than when she came in. So she went to an orthopedic surgeon, and from here you can probably guess what the orthopedic surgeon said. They said the chiropractor caused the injury and you should never go back to a chiropractor. You should never let a chiropractor adjust me, which is total bullshit, because the reality is that the condition was already existing in the patient's neck. The problem was the chiropractor did it unintentionally and he didn't know that it was there, but he failed to do an exam and x-ray and unintentionally exacerbated her condition by not doing a proper exam and x-ray. And of course, now the patient and the orthopedic surgeons will all continue to condemn chiropractors from this one incident alone, which is honestly the worst thing that could happen. Now, the surgeon, of course, told the patient to never go to a chiropractor again and that she now needs surgery. And guess what? She ended up getting a cervical spine fusion from C4 to C7, which is really sad. Of course, she ended up getting the surgery, but here's what happened. The patient was not better after surgery. In fact, she actually got worse after surgery and really didn't even require surgery in the first place. But hey, guess what? I guess I'm not a surgeon, so I don't know what's best, right? Now, after years of suffering from post-surgical pain, the patient finally decided to trust a chiropractor again and reported to Dr. Deed Harrison's office. And when she reported to the office, she had chronic neck pain of 6 out of 10. She had left arm numbness. She had migraines one time a week. She had left foot pain and tingling when walking, and she had a decreased range of motion in her neck with massive stiffness and a constant pulling of her neck muscles. She was also on 7 pain medications. I repeat, she was on 7 pain medications. Things like Tylenol, which is made up of acetaminophen and codeine. She was on fentanyl. She was on Emerge, which is the anti-migraine. She was on antidepressants. She was on antiemetics. She was on muscle relaxers, and she was even on OxyContin for a little while there until she was taken off. 7 pain meds. Wow, totally just nutso. Now, the patient filled out a health survey form called the SF-36 that lets a chiropractor or any kind of physician know, based off her age and population norms, how she was doing objectively on her social functioning and her mental functioning state, and how she was feeling physical, meaning her overall pain levels. Now, her social functioning was so low that she couldn't even hang out with her friends or do the things she wanted to do because of how much pain she was in. Now, on her neck disability index survey, she was at a 64%, which is a severe amount of pain and disability. Now, what Dr. Harrison found was that this patient had a 28 millimeter lateral head translation to the right, which is 1.1 inches. That is a lot. Now, you may be sitting there saying, 1.1 inches is not a lot, but why don't you go ahead and shift your head to the right 1 inch and walk around like that all day, and you will find it was very uncomfortable. In fact, the maximum amount a human should be able to translate their head to the right or left is 35 millimeters. This means that the patient is in 80% of her maximum range of motion. She had 28 millimeters of lateral head translation. 35 is maximum. That is insane. It is 80% of her in range of motion, and she is stuck in this position in her neutral posture. This is extremely stressful on the muscles, ligaments, and nerves coming out of her neck. No wonder why she's in so much pain. She's almost maxing out her entire range of motion. Now, this patient was from Canada. So in order for her to receive proper care, correction, and increase her quality of life, she needed to set aside 2 weeks where she could stay in the United States and undergo an aggressive but precise treatment regimen. She was treated several times a day for 11 days straight. She had 25 sessions over an 11-day period. This consisted of mirror image postural adjustments, mirror image postural instrument adjustments, mirror image postural exercises, and mirror image postural spinal translation traction to correct her right head translation posture. She had these treatments 2 to 4 times per day. After 11 days of care, her right head translation was reduced by more than 50% and went from 28 millimeters to 13 millimeters, which is extremely impressive considering she had surgical fusions up and down her cervical spine and her age of 56 years old. Now, after 11 days, she retook her health surveys, and her SF36 health survey went from a 36.5 to a 51.5 on her physical pain component, and it went from a 38.6 to a 58.9 on her mental outlook component. For those of you who don't know the significance of these scores, let's just say these scores are pretty impressive. After years of chronic pain and disability, Dr. Harrison was able to significantly increase his patient's quality of life in just 11 days. Based off these scores, she was just below population norms. Now, this just goes to show that a one-and-done approach to spinal rehabilitation is super unrealistic. This patient needed more care even after 25 visits. Think about it. She had been living with this condition for years. You can't expect to fix a 56-year-old spine overnight, just like you can't expect to grow a muscle and obtain a six-pack after one workout session. You don't change muscle and tissue in a day. It takes months to even years to see change in your body shape, and it is no different for your spine. And she was able to achieve incredible results in just 11 days using chiropractic biophysics techniques. Now, also, after 11 days, the patient was able to self-terminate all of her pain medications under supervision of her medical doctor, but was still advised to stay on her antidepressants, as people cannot rapidly come off antidepressants or antipsychotics for that matter, because it takes more time for your hormones to cycle back to normal. Now, as chiropractors, we can't legally tell a patient to stop or start any medication, so we always advise the patient to speak with their medical doctor to help guide them off medications. But the cool thing as chiropractors is that we get to witness patients coming off medications and having way less pain, even when taking pain medications, which goes to show addressing the underlying condition and successfully improving function conservatively will likely outperform the effectiveness of pain medications. Now, after 11 days, the patient's neck disability survey also decreased significantly and went from a 64% of severe disability to a mere 12% of mild disability. I don't think you guys understand. This is massive. You don't understand how incredible this change is. Just to give you perspective, by improving by 10.5% is clinically significant. This patient improved by 52% in just 11 days. It's insane. Now, since then, this patient is still doing amazing and continues to see changes in her quality of life every single day. This case is just one of thousands of cases that it has been giving a person their life back by utilizing chiropractic biophysics technique, by changing posture and spinal structure long-term, and not just a quick crack of the back or neck that traditional chiropractic provides. Now, there are two more cases that I will discuss quickly, but before we get into that, I want to touch on some other symptoms or conditions you might be experiencing that you may not know is coming from your spine or even your poor posture. Now, with dysfunction in your upper and mid back, you can experience conditions such as upper back pain, trapezius tightness, pain between the shoulder blades, and posterior shoulder pain. You can also experience heart palpitations, high blood pressure, racing heartbeats, heart murmurs, and anxiety. You could be experiencing shortness of breath, asthma, wheezing, bronchitis, chronic coughs, rib pain on deep inhalation and expiration. And we also know that the nerves in your upper and mid back can create issues like stomach ulcers, acid reflux, heartburn, indigestion, gas, bloating, constipation, diarrhea, nausea after eating, being tired or irritable after not eating for a while, and blood sugar dysregulation, kidney stones, gallstones, adrenal fatigue, and even food sensitivities can be coming from a poor posture of the upper and mid back. Now, if you experience any of these aforementioned issues, you might want to consult a chiropractor or a chiropractic biophysics doctor to truly see if there's something going on with your posture or anything on x-ray. Now, lastly, we're going to talk about your lower back, which is your lumbar spine, which, like I said, are the bones in your low back that go down into your legs. So you could be suffering from things like low back pain, hip pain, hamstring tightness, iliotibial band, aka IT band tightness, tailbone pain, hip pain, leg pain, numbness and tingling in the legs or feet, coldness in the feet, cramping in the legs or feet, weakness in the legs or feet, loss of patellar and Achilles reflex, muscle pain and soreness, gait disturbances, aka walking disturbances. You could even have ulcerative colitis, Crohn's disease, poor gut microbiome, a nutrient deficiency and malnutrition due to poor malabsorption. You could have poor sex drive, erectile dysfunction, inability to become pregnant, heavy menstrual bleeding, and heavy cramping. Now, that was a lot, but I need you to understand that all of those issues could be coming from your spine without you knowing it. That's why I want to bring it to your attention. Now, since we just covered potential issues with a poor lumbar spine, I want to talk quickly about a woman that one of my colleagues, Dr. David Bach and Dr. Curtis Fedorchuk, helped in private practice utilizing chiropractic biophysics technique. Now, the case that I'm going to mention is titled Resolution of Vulvodynia Following Chiropractic Care Using Chiropractic Biophysics and Diversified Techniques, a case report. Now, just to set the stage, for those who don't know what vulvodynia is, it literally translates into painful vagina. Now, this was a 50-year-old woman who had pain inside and outside of her vagina. She had been suffering with vaginal pain that radiated into her low back. This pain was going on for months, and she had exhausted all medical treatments, and she saw many specialists, and nobody could help her. It was at this time that her marriage was actually coming into question because her husband started to believe that she may be cheating on him with another man because of her painful vagina. He thought that they were just having a lot of sex. Now, like I said, her marriage was being torn apart as her husband was at his wit's end. Now, it wasn't until she visited Dr. Bach and Dr. Fedorchuk that she finally found the reason as to why she was having vaginal pain. Turns out that through X-ray radiograph that her lumbar spine curve was far from normal and was causing inflammation of her nerves originating out of the low back that go into the vagina. To her astonishment, she couldn't even believe it was her spine this entire time that was causing her pelvic distress. Now, through chiropractic biophysics analysis, adjusting methods, postural exercises, and spinal traction, this patient was able to get both her health back and her marriage back to where it deserved to be. The results from this study showed that chiropractic care had a major benefit in not only decreasing symptoms, but enhancing nerve function from the spine to major organs. This also goes to show that chiropractic biophysics technique has high inter-examiner reliability. This means that through the ideal spine model, using CBP methods of analysis, doctors can successfully achieve the same results with patients if they stick to CBP concepts and methods. So next time you have organ pain or any form of musculoskeletal pain, think about your spine health first, because that is the origin of most conditions we suffer with today. Now, I want to leave you with one more study that I actually helped write. It was this case that was done by Dr. David Bach and was handed to me to write up for my senior research project. Now, this case was really fun to write up as it involved increasing athletic performance by addressing human biomechanics using chiropractic biophysics technique. The paper was titled Improved Quality of Life and Athletic Performance Following Chiropractic Care Using Chiropractic Biophysics Protocol. And like I said, you're going to have access to this paper that I wrote at the bottom of the episode show notes. So go to the bottom and click on that link if you want to read this article. Now, the case involved a 36-year-old male athlete who was previously involved in a motor vehicle accident and presented to the office with low back pain, shoulder pain, and neck pain with concurrent headaches. This patient was a big-time CrossFit athlete and lifted some heavy weight before even entering the office. Now, his deadlift was approximately 430 pounds, his squat was about 400 pounds, and his bench press was approximately 370 pounds before care. Now, before he started care, he filled out surveys, just as most chiropractors or physicians will have people fill out health surveys to see where they at when they start, and then see where they're at the end to see objectively how they got better or got worse. So he filled out a headache disability score, which was rated at a 62 out of 100, which is code for severe headaches. And he had a neck disability index score of 34, which is moderate to severe pain. And his back disability index was 28, which is severe disability. Now, the patient underwent chiropractic biophysics corrective care consisting of CBP mirror image traction, mirror image exercises, and mirror image postural adjustments. The patient was seen 3 times per week for approximately 3 months for a total of 38 visits. Now, here's the most amazing part of this case. This alone will drive you to see a CBP doctor even if you don't have pain. The patient was instructed to stop all heavy lifting for 3 months. He was not allowed to step foot inside a gym or lift anything at all. Again, for 3 months, he wasn't allowed to lift weights. He was to dedicate his time into coming to the office 3 times a week to work on his biomechanics, muscle strength, and ligament rehabilitation. And after 3 months of strict chiropractic biophysics care, This patient increased his strength and performance by 50 pounds on his deadlift, his bench press, and his squat. This is one of the most amazing things I've ever heard out of chiropractic biophysics care. Because again, remember, this patient didn't lift a single weight for 3 months. For 3 months, the only thing he did was fix his posture, fix his spine, and fix his biomechanics. And he was able to gain strength by 50 pounds on all of his lifts and increase human performance. It's amazing. Absolutely phenomenal. Now, if that wasn't amazing enough, his headaches dropped to 0. He had no headaches. His neck pain dropped to 0. No neck pain. And his shoulder and back pain dropped to 0. Wow. Who would have thought that bringing your spine back to their ideal curvatures would decrease pain and increase quality of life? Yet, we have surgeons who want to cut on people and chiropractors who want to, quote unquote, heal people with their magic hands and energy-based techniques that have no scientific merit. Anyway, I'll get off my soapbox, but I hope I brought some light to some misconceptions regarding traditional chiropractic care and chiropractic biophysics. Again, if you have had a bad experience with a chiropractor, go find a new chiropractor that suits your needs and interests. There are good and bad chiropractors, just like there are good and bad medical doctors. If you are looking to take your care and quality of life to another level, I will highly recommend you seeking out a chiropractic biophysics doctor in your area by going to idealspine.com/directory. From here, you can put in your address and search any CBP doctor all the way within 500 miles of you. You can also search a city and see if there is a CBP doctor near that city or address. Now, if you want my personal recommendation on who to see near you, please reach out to me and I will gladly direct you to a CBP doctor that I trust and know personally. Again, I'm going to drop this link down in the show notes for you guys to click on to find a CBP doctor near you. It's idealspine.com/directory. Now, if you are enjoying the hour-long episodes that I'm doing packed with research and new advances in medicine, I would be so appreciative if you left a review and rating, and even share with some of your friends and family. I put a ton of time into making these episodes, and it would mean a ton to me if you gave me some feedback or reached out. If you want to reach out to me personally, I would love to help wherever I can. Message me on Instagram at @theunleashedhuman, and I will personally help you out with anything you have going on, whether that is losing weight, better sleep, better headspace, getting stronger in the gym, cleaning up your diet, or even to just say hello. I'm always here to help out. So lastly, like I said earlier, if you haven't already, you can literally right now go get my free book. It is seriously free with no shipping, no waiting. It's emailed directly to you. All you have to do is go to www.theunleashedhuman.com/unleashed to get your free copy of The Unleashed Human. Well, that is it from me on this episode. Until then, take care of yourself, and as always, strive to become unleashed. Talk soon.